All right, everyone. It's that time in the morning where we're going to get up and move our bodies. I have the pleasure of introducing Julie Rowland, who is our certified yoga therapist through the International Association of Yoga Therapists. She's vital to our Integrative Medicine Collaborative, teaching 2 weekly classes for the collaborative, as well as working as a stress management specialist in the interdisciplinary team in the Dean Ornish program for reversing heart disease. Thank you so much for leading us in this practice this morning, Julie. So welcome.
Thank you, Dr. Muller, for that cordial introduction, and welcome to everyone to our session on yoga therapy, movement, and breath. Let's begin by standing. The hips will be inside of the feet. Start with a nice and gentle tap and twist, and let the hands fall wherever they may, giving a rotation to the spine after the sitting. Notice you've chosen a rhythm and a pace, discerning. One more time on each side. As you come to standing, looking down at the feet, now we're standing hip width apart, lifting the toes off of the floor and dropping the soles of the feet onto the floor. We're adding consciousness to the body. Lifting the kneecaps and tightening up the quadricep muscles. One hand on the belly, one on the low back, pointing the tailbone down so that the pelvis slightly tilts upward. Reaching the hands down by the side of the body to lower the shoulders and tucking the chin back to avoid the forward carriage of the head. Beautiful plumb line from the ear to the shoulder, shoulder on top of hip, hip on top of knee, knee on top of ankle, joint on top of joint. As we come into Tadasana, one of the oldest poses in yoga. We'll use this pose to center, using the somatic sensations of the body, coming to our senses. Bring your awareness to pressure, the pressure of the feet on the floor, equal pressure, and the absence of pressure everywhere else. And then let that go as you bring your awareness to temperature, noticing the temperature of your body where it's clothed, as opposed to exposed to the air. And let that go as you bring your awareness to sound, your ability to hear. Hearing sounds in the room, sounds outside of it. And let that go as you bring your awareness to touch, the sensation of touch of your clothing on your body, maybe jewelry or glasses or the hair on the back of the neck. And then let that go as you bring your awareness to taste or lack of taste. Maybe something lingering. Notice the moisture of the tongue or lack of moisture. We begin our conscious movement here by dropping the tongue from the roof of the mouth, separating upper teeth from lower teeth, helping ourselves drop out of sympathetic nervous system overload. From here, bring your awareness to the breath, the unassisted quality of the breath that is never not here, that does not discriminate, the air that gives equally to all. And from here, we'll begin abdominal breathing, inhaling and exhaling through the nostrils. Let the belly come away from the spine with the inhale, and the belly pushes back with the exhale. You can keep your hands where they are or bring one hand to the belly and one hand to the chest, trying to keep the breath from initiating in the chest, which is where we breathe when we are feeling stressed. Choose a rhythm and a pace that you can maintain here, once again, discerning. Connecting physical body to energetic body, to that part of ourselves that can choose. Keeping the breath as smooth as you can, equal parts inhale and exhale. If you're touching the body using the sensation of touch, our first language. as we stand in one of the oldest postures there is in yoga. Abdominal breathing helps us reduce cortisol, the stress hormone that's highest in the morning. This is a nice practice to begin your day. If your hands are on the body, bring them down to the side of the body. And from here, you have the option of returning to the chair or continuing the practice in standing. Entirely up to you, eyes opened or closed. Continue with the nostril breathing, with the abdominal breathing. And begin to notice that breath is the beginning of movement. This conscious breath is the beginning of movement. With every inhale, there's extension. With every exhale, there's flexion or folding. And as we begin to connect movement to breath, following this natural inclination of the body, with your next inhale, lifting the chin up toward the ceiling, the palms toward the screen. And with the exhale, hands come to the thighs, bending in the knee, knees tracking right over the feet. Inhale as you open and extend, little arch in the low back. Exhaling, the knees tracking right over the feet without passing the toes. This is your posture. Continue on your own, choosing a rhythm and a pace and a speed. Letting the breath lead. Releasing the joints in the cervical spine and the neck, thoracic spine, in the torso, the ball and socket of the shoulder, the hinge joint that we call elbow, the fingers and the wrists, the hip joint and the knee joint and the ankle joint. This is another great posture to begin your day, to increase viscosity of the joint. One more, just like this. As you come into a hold with the knees bent, here you have the option of having your hands on your thighs, which is good, your hands on your hips, which is also good, or the hands reaching away from the body with the palms facing each other, fingers together, thumbs up toward the screen. Keep the chin tucked toward the chest, lengthening in the back of the neck. Utkatasana, chair pose. Take a deep inhale here. And with your exhale, straighten the legs and bring your hands to your thighs, coming into a flat back. Here, you can keep the stance where it is, or for more friendly low back and hip, you can widen the stance. You can keep the hands where they are or lower them, maybe reaching for the floor, maybe not. Wherever you are, letting the head hang and keeping the breath as smooth as you can. On your next inhale, tuck the chin to the chest. If you're standing, bend in the knee and slowly roll up one vertebra at a time. If you're in the wide stance, heel toe, return to mountain pose. With your next inhale, circle sweep, reach the arms up, clasp the fingers and flip the palms up toward the ceiling. You can have a bend in the elbow or lengthen the arms without locking out the arms. Lateral flexion next. Inhale. With your exhale, crescent pose toward the right. Equal pressure on both feet, pushing the hips toward the left. Looking down at the floor. Inhaling. Exhale, look straight ahead. Inhale here. Exhale, look all the way up. Inhale, reach the hands up. And exhale, release the grasp, hands come to the side of the body. 3 deep inhales and exhales here. Practicing being responsive instead of reactive before we go to the opposite side. On your next inhale, circle sweep, reach up, clasp the hands your non-habitual way, and flip the palms up toward the ceiling. The inhale lengthens and extends the spine. With the exhale, crescent toward the left. Equal pressure on both feet, hips pressing toward the right. Holding the pose, not holding the breath, looking down at the floor. Inhale. Exhale, look straight ahead. Inhale here. Exhale, look all the way up. Inhale, follow the breath up as you reach up. And exhale, bring the hands down to the side of the body. From here, we'll come into seated posture, moving the flesh away from your sitting bones so that the tailbone gets a really good connection to the earth. We'll end the movement with rotation of the spine. Easier and more friendly for the low back and hip if you have issue is the open twist. You can choose that or cross the right ankle over the left or the right knee over the left. With your inhale, reach the arms up to lengthen in the spine. With your exhale, twist toward the right, choosing just the right amount of torque. Not too easy, not too hard. Inhaling here. Exhale as you unwind head, shoulders, and low back. If the legs are crossed, uncross. Take a deep inhale here and sigh it out through the mouth. Decide what you'd like to do on the left side. We are not symmetrical by architecture or by history. So either open, crossing ankle, or crossing knee. Inhale, reach the arms up. Follow the breath as you exhale, twist toward the left. Breathing, perhaps noticing the tendency to hold the breath, which is what we do when we are feeling stressed. Take a deep inhale, and on your exhale, unwind head, shoulders, and low back as you uncross the legs. Inhale, circle sweep, reach up. Exhale, follow the breath all the way down as you fold. Hands on the thighs, on the shin, reaching toward the floor. One deep inhale here. Exhale completely. Tuck the chin to the chest as you slowly roll up one vertebra at a time. Coming into a comfortable seat. For 1 minute, sitting in stillness and quiet, letting your conscious breathing go. Notice how the respiratory system is always there for you. We take about 17 to 20,000 breaths a day without you having to do a thing. One last breathing technique here, extending the exhale. We release so much toxicity through the exhale. We'll make a shushing sound with the exhale. As soon as you feel it's time to inhale, please do create your own rhythm and pace. Inhale, nostrils. Exhale. Shh. 2 more on your own. Pressing the palms together in front of your heart space. Now separate the palms, fingertips and thumbs, light pressures if you're holding a strand of hair or a thread. This is Hakini Mudra and it's used for focus. Think about somewhere in your life where you can use this mudra, maybe personal practice, maybe for the rest of our conference here today. Letting the information that doesn't serve your purpose go through your fingers and the information needed catching in your palms and fingers. Slowly close the pose as you press the palms together. The teacher in me honors and bows to and respects the teacher in each one of you. Namaste.
Namaste.